Well, as fall arrives and the temperatures decrease, the dangers of developing pneumonia increases. Pneumonia remains a leading cause of respiratory illness and a critical topic for patients, caregivers, and clinicians. And it's prudent to be prepared to recognize the symptoms, ask informed questions, and act quickly when it matters. Dr. Brandon Bentley with the Department of Family and Community Medicine at Wellstar MCG is back with us this morning to talk about the dreaded pneumonia. First of all, you see it. It doesn't even look like it's supposed to say pneumonia, but there it is.
Yeah, that's a tongue twister and a word for Wordle and Spellmaster or whatever other game you want to play.
It's a 10-pointer right there. Let's kick it off right here. What exactly is pneumonia?
Yeah, so pneumonia is a lung infection. It can be caused by bacteria, viruses, fungi that get in there, they proliferate within the lungs, and they really end up causing systemic symptoms, can lead to a lot of illness, and unfortunately, some people do pass away from pneumonia.
Let's talk about those symptoms because there's so much stuff that's out there floating around. So what exactly are you looking at if you're trying to diagnose pneumonia?
Yeah, so pneumonia typically will have those symptoms we think about for flu and cold, but it's those symptoms plus. So you get the cough, you get the shortness of breath, you're also getting fever. Sometimes you can even get confusion. In our older patients, pneumonia can lead to an altered mental status. It's whole body chills, whole body aches. So it's really a systemic disease. This is going to cause symptoms for the whole body and really lead to just more than that runny nose and cough and cold that we get typically around this time of year anyway.
Who is actually at highest risk for contracting pneumonia?
Yeah, so our highest risk patients are our young children and our elderly adults. So under 5 and above 65 have to be especially aware of pneumonia and the symptoms so that they can take steps to prevent it. These are the populations that are going to have the biggest risk factors associated with pneumonia. So those are the ones who are going to be hospitalized and have the worst outcomes. In addition to our patients with chronic illnesses such as chronic heart conditions and chronic lung conditions, and anyone who's immunocompromised.
You just mentioned prevention. Can pneumonia be prevented?
Yes, so we do have very good preventative measures. In addition to what we can do on a daily basis, washing our hands, covering our mouth, avoiding to touch our face and our mouth after touching other things without washing our hands, we can get vaccinated. So there are pneumonia vaccines available, and we urge everyone who is a candidate for pneumonia vaccines to go out, talk to their doctor, and get the appropriate vaccine for them.
It's also flu vaccine season here, since you're mentioning the vaccines. Can you get multiple vaccines for this, or is that a possibility?
Yeah, so you can get your flu shot and get your pneumonia shot, and you can get a COVID update per the CDC guidelines and a discussion with your physician. So it's important to prevent as many of these illnesses as you can. Even if you still do catch the illness, your symptoms are likely to be lessened and your outcomes are likely to be improved. Nothing is ever 100% in life, but if we can do our best to prevent our outcomes and do what we can, then we're going to be better off long term.
Okay, flip side of that question, you can get multiple vaccines. Can you get all three contractions at the same time?
Yes, you can have a flu that is a cause of pneumonia. Similarly, there was COVID-19 pneumonia, I should say is COVID-19 pneumonia. We certainly saw a prevalency when it was very rampant. We still do see it in the hospitals, so COVID-19 is not gone. It is still within our communities, so very important to prevent those illnesses and do what we can to stop the spread.
Right, so the biggest takeaway, talk to your physician. Make sure that you are prepared and doing as much as possible to avoid and prevent getting pneumonia.
Absolutely. Take advantage of the measures that we have and the vaccines that are available for our community.
All right. Dr. Brandon Bentley, we appreciate the info.
Great to be here.
Thanks for joining us.